name is Roxana Kiss, and I am one of the new gastroenterologists on staff here at Humber, and I've been here for nearly 3 months now. So my day-to-day really is split into two components. My outpatient clinic, where I see my patients in consultation, and I can see a wide range of presentations from acid reflux to irritable bowel syndrome to inflammatory bowel disease, which is my area of expertise. And the second component of my day revolves around performing endoscopy or endoscopic procedures, which I love because I get to use my hands, and I love the immediate satisfaction of helping patients, whether it be by symptomatic relief or stopping a GI bleed, removing an advanced lesion. That's just all very special to me. So I've always known that I wanted to be a physician. A gastroenterologist in particular. I think it was in medical school that I realized that GI concepts just came naturally to me. I was just very drawn to anything GI and just fascinated by anything that was gut related. I also know that I'm good with my hands, and so I knew that I wanted to work with my hands on a day-to-day basis, and that's what led me to pursue further training in advanced luminal endoscopy. So I enjoy that my work is a perfect balance of an intellectual challenge and the satisfaction that I get from performing complex endoscopic procedures. I love being able to manage patients with complex inflammatory bowel disease because they can be quite sick, and so it's very gratifying to be able to make them well again. And going back to endoscopic procedures, I'm very happy to be able to manage complications of inflammatory bowel disease, such as dilating strictures and managing fistulas. But also it's very satisfying to be able to identify and resect early precancerous lesions and potentially spare a certain patient population from surgery. I was fortunate to do an elective here at Humber when I was in my 5th year of GI residency, and I liked it here so much that I decided to do a second elective. Now that I'm here on staff, Humber just feels like home. I was originally drawn to Humber because of the high volume of endoscopy, which is unrivaled anywhere else. But now that I'm here, I realize that there is such a great spirit of collegiality between the gastroenterologists and the surgeons in the endoscopy unit, and that's just very important. I knew that I wanted to teach, and so Humber, despite being a community center, allows us the opportunity to teach medical students and residents. I was fortunate to have fantastic teachers and mentors throughout my training, and I'm just very excited to be able to pay that forward. So just about everything, the state that the program is currently in, but then also the potential for transformation and growth. I'm very excited to continue to learn from the gastroenterologists here at Humber that have been here for quite some time, who have a tremendous amount of experience and knowledge. So I look forward to being a sponge for all of that. But I also know that there's room for me to create my niche here at Humber. Like I mentioned previously, my area of academic but also clinical interest and expertise is that of inflammatory bowel disease and advanced luminal endoscopy, and really the marriage between the two. So I'm very excited to bring an intestinal ultrasound program to Humber to be able to manage patients with inflammatory bowel disease, to manage the complications of inflammatory bowel disease, and ultimately to be able to set up an advanced resection program. So there's tremendous potential for transformation and growth in the endoscopy unit at Humber, and that's just very exciting.